Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Dr. Strang will give us an update on where we stand with COVID-19. But first, on behalf of the people of Nova Scotia, I want to extend our deepest sympathies to everyone impacted by yesterday's tragedy. We now have more information about the number of victims, who they were, and who they left behind, and how their contributions that they made to their friends, their families, and indeed to our province. The heart behind us has meaning. It's about our love for each other. It's about strength. And it's about getting through this together. I will ask Dr. Strang to give us an update.
Thank you, Premier. And indeed, this tragic news from yesterday is a reminder that every day first responders go to work putting themselves at risk for our health and safety. We also have, especially during this COVID-19 event, healthcare workers, other essential workers that are doing the same, go to work on our behalf, putting themselves potentially at risk for our health and safety. Please let's not forget that. Today we are announcing 46 new cases of COVID-19, which brings the total number of confirmed cases in Nova Scotia to 721. We currently have 12 individuals in hospital, 4 of those in ICU. 248 people have now recovered and their infection can be considered resolved. We have tested Nova Scotians and have negative results for 21,769 people. We now have 9 licensed long-term care homes and unlicensed seniors facilities that have at least one case of COVID-19, and in total that involves 127 residents and 61 staff. The vast majority of these cases are in Northwood, and our overall provincial numbers, the new numbers we announced today, the large majority of those are also from Northwood. I know Northwood provided a media update not long ago, and I won't go into any more detail about the Northwood situation other than to say that they are working day and night, being supported by the entire healthcare system to provide the best care to their residents and support their staff through this very difficult situation. Over the past 24 hours, our province has seen events unfold that will leave us all reeling. We are hurt, we are mourning, and the whole country mourns with us. I also want to offer my deepest condolences to the victims, their families, and loved ones. I know several of the victims have now been identified, and we've learned that some are healthcare workers, along with the RCMP officer who was identified yesterday. I know the whole health system is mourning these individuals and all victims. This unprecedented situation we face with the COVID-19 virus makes this unspeakable tragedy and how we deal with it that much more difficult. I know what I'm about to say is going to be hard for people to hear, especially when we're going through so much pain at this time. And while we want to mourn victims and come together as communities, we need to do that in a way that does not create an environment for COVID-19 to further spread. I know that the RCMP and the victims' families do and will appreciate the outpouring of support that is coming their way, but we cannot have people gather together as part of showing this support. As part of the public health order, we need to remember that all gatherings must be of 5 people or less. And even when people get together in those numbers, we need to maintain social distance. So please, people being on the streets, honoring police, we don't need that and can't have that. RCMP just in the last hour or so came out with a very similar message. We welcome and ask for your support and for your tributes and honoring people, but please, we need to do this virtually. The COVID-19 is not going to pause because of our pain. We cannot let our guard down and create even more challenges by having COVID-19 spread further. Again, I'm sorry I have to say this. I know it's difficult, but we need to continue to stay strong and deal with both of these difficult circumstances in a way that doesn't that sees no one else get hurt, sick, or die. When COVID-19 is past, and it will, we can come together as a province stronger than ever to remember the victims of yesterday's tragedy in ways that we were more accustomed to. But today we need to focus on mourning safely. In our efforts to flatten the curve, protecting our healthcare system, and the brave individuals who are helping us to battle COVID-19, we cannot stop in our efforts of separating, of staying away from each other, preventing the virus to get a further foothold. And lastly, I'm going to say, so the public and especially the media are aware, we have received a number of requests from media outlets outside of Nova Scotia who are looking to come in and bring reporters in to support their coverage of events in Nova Scotia. But we have said no, unfortunately. There's no exemptions. We cannot give exemptions for this purpose. We're asking media outlets to rely on reporters that are already here in the province of Nova Scotia, or make alternative arrangements. I bring that forward to say, as an example, while we're asking Nova Scotians to be strong and to adhere to public health orders, we're being equally strong with others who are asking for exceptions. So I'll end today to say it's a very difficult day for all of us. Yesterday was a very difficult day. It's a reminder to me of how we need to deal with as life comes at us every day, whether it's tragic events, whether it's COVID-19. How do we be the best people that we can be together? By being caring for each other, by building up community, and by just being compassionate with each other. Thank you.
Over the last 5 to 6 weeks, I've got to know Dr. Strang extremely well. He's a caring, compassionate man, and I know how difficult it was for him to be able to communicate that message to all of you who are suffering and want to be together. But I want to support him to deliver that message. It is a critical time for us to find a way to mourn, to find a way to heal from a distance. And with that, we'll answer any questions.
Again, we'll go to the phone lines. We'll take one question and one follow-up from reporters on the phone in the allotted time that we have. Please ensure that your lines are on mute. We'll start with Paul Withers from CBC. Go ahead, Paul.
Good afternoon, gentlemen. My question relates to what we've seen from Northwood. I guess if I look at the numbers, with 111 residents there, that's over 20% of the population is now infected. What can we expect, Dr. Strang, going forward at Northwood, given just how prevalent the infections are now?
So, unfortunately, we will expect to see more cases. I know my colleagues in public health, Dr. Daniela Kempkins, who's the lead MOH on the Northwood outbreak, was involved in conversations today that I've been part of, and we're developing a broader testing strategy that would look to first of all test everybody in that facility who has not been tested, and then continue to do repeat testing for people who have been tested but are negative. So we know that the virus has spread broadly through Northwood. We fully expect as we expand this testing, we're going to get more positives. We'll continue to support testing any health care workers who develop symptoms who are for some reason have not been tested yet. So yes, we will see more.
Go ahead, Paul, with your follow-up.
And I'm wondering, the Northwood officials made it quite clear today that the reinforcements that were sent in by the province have made a difference, has eased the strain, as you might expect. But I'm wondering what happens if this happens at another large long-term care facility. Do we have enough people to spread around to deal with a similar outbreak if it happens anywhere else other than Northwood?
So we certainly will do whatever we can within the resources of the healthcare system to address support other long-term care facilities. Northwood is by far the largest facility we have, but we have to remember that this is the reason we've spent the last several weeks, or one of the key reasons we've spent the last several weeks talking about why we need strong public health measures, why we need to work together to minimize the spread of this virus. It's exactly to your point of the question, we cannot overwhelm our healthcare system, which includes our long-term care facilities. If we allow this virus to spread unchecked and did nothing, that's exactly what would happen. So what we can all do to make sure that we're able to deal with all the impacts of COVID-19, whether it's Northwood or other long-term care facilities, is to stick with the tough measures that we have in place. We need to continue those at least for the next few weeks so we can get through this. We will continue to have COVID-19 spread, but it will be manageable within the resources we have available to us. And we have a particular issue around long-term care facilities that across the country it's becoming very clear that these are being the most areas of greatest concern with COVID-19. And I come back to what I've said in the last few days is that all of us, it's necessary to do what we need to do, not so much to protect ourselves, but to protect our communities. And by minimizing the spread of COVID-19 in our communities, we are preventing and minimizing the chance of a further outbreak like Northwood in another community in Nova Scotia.
I just want to give a shout out to our partners. The healthcare unions have joined us in this fight, along with NSCC with their CCA students and nursing students, all the health allied professionals. But our colleagues representing the unions across the province stepped up when we required their help with Northwood. And I have every confidence that they and their members share in our collective desire to ensure that we deal with COVID and move on to a normal life as soon as possible.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. I'm just wondering, first of all, for Dr. Strang, whether or not you can confirm if COVID positive patients or residents, rather, at Northwood who have tested positive for COVID-19, are they still being housed in the same room with patients who either have not been tested or who have tested negative?
So one of the key objectives, and it was identified in my conversation with Northwood this morning, the key objective is to get people out of those situations as quickly as we can with a combination of the testing strategies and as removing recovered people and allow more flexibility to create COVID units. So there may still be some there today, but the objective is to get everybody out of those as quickly as is possible. Even when they're in those situations, we're applying strengthened infection control measures as we brought in more resources to bear with the support from the Nova Scotia Health Authority.
Go ahead, Natasha, with your follow-up.
Thank you. For the Premier, I'm wondering, last weekend or Easter weekend, we saw quite a few emergency alerts put out on TV and through cell phones warning people to stay home because of COVID. Yesterday, when there was a manhunt that lasted almost 12 hours, that service wasn't utilized. Can you explain why and whether or not you feel perhaps we missed an opportunity with that to spread the message further, and if that could have made a difference in this tragic situation?
Well, EMO needs to be ordered to put that out. Public Health ordered us to put the COVID one out. We were happy to support them. We had people in and ready, but we were not asked to put out that alert on the weekend.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Yes, Premier, on that point, are you concerned that the RCMP did not ask you to do that? They didn't have answers for us today as to why that wasn't done. Is that a concern for you?
Listen, this is a province in mourning. There will be lots of questions. I can tell you, I'm not going to second guess why someone or the organization did what they did or didn't do at this moment in time. This was an active environment. I can tell you, deaths, gunfire. Let's give them an opportunity as an organization to explain that to you. My job today as the Premier of this province is to do all I can to provide support and comfort to those families and the citizens across this province as we deal with this tragedy.
Go ahead, Keith, if you have a follow-up.
Yeah, it's for Dr. Strang. I kind of asked you this, I think, almost maybe a week and a half ago when the numbers really shot up. So I'll ask you again, do we have any more light on why Nova Scotia appears now to be the epicenter of this outbreak in Atlantic Canada? There's community spread, and it seems to be as a result mainly of nursing homes. Is that the main reason? And first of all, do you agree with that statement?
So I think we got to break that apart a little bit. The community spread is not the result of outbreaks in nursing homes. It's the reverse. We have community spread, which then results in workers who unknowingly take the virus into long-term care facilities. So we actually look at where we are at with our epidemiology of COVID-19. We actually have on the downward slope. Even in the communities in Dartmouth East area, that there's still a lot of challenges there, but we're getting a handle on that. What we're seeing is while that's coming down, the outbreak in Northwood is driving our numbers. So we have almost two different outbreaks going on, and we need to look at that and understand that in more detail, because that actually informs our thinking moving forward when we talked about when is it feasible to start to relax some of our restrictive measures. This is actually what we're seeing now more and more across the country, where as in general in community the spread of COVID is slowing down. Where we're seeing still the most trouble areas are areas where people are brought together to live, whether it's long-term care facilities, residential care facilities, homeless shelters. Those are the areas where we're seeing more and more are becoming the focus of COVID-19 transmission as we get a handle on it more in the broader community. So that is going to present a number of challenges moving forward as we open things up. We have to remember that opening up also puts some of these group living environments, I'll call them, at ongoing risk.
Next, we'll go to Alicia Draus from Global. Go ahead, Alicia.
Hi, yeah, I'm just wanting to follow up a little bit about Northwood and just if the cases continue to rise there. I know there's a lot of support from the medical community to help them. But how sustainable is it, and could we at some point have to follow, I guess, Quebec's lead in turning to the military for more help?
So we're aware of that as an option, that everything that is being brought to bear. And I think what we heard on the weekend and saw from the rest of the health care system has stood up, and it will help Northwood. We'll do that as with the resources that are necessary. We do have connects with the military, and we have a way to reach out if needed, but we're nowhere near that point. And we'll work as a health system and do what is necessary and ask for help when we need it. I do want to say that while I have the opportunity of the question, an issue came up as I was talking to the media yesterday, and I just want to clarify that if I left the impression that in general in long-term care facilities that we won't transfer people to the hospital if they need it, that it was wrong. We know that in many circumstances in long-term care facilities, either because of clinical conditions and in combination often with family or personal wishes, that people don't want to get transferred to an acute care hospital. But if there is a clinical reason and it aligns with the care plan, which is agreed to by the family, and there's a need to transfer somebody, that will happen, regardless of the long-term care facility.
Go ahead, Alicia, with your follow-up.
This is sort of addressed last week, but the question was posed about as we lean on more resources from the healthcare system to help out with Northwood, whether or not staff are moving between facilities. And I know you had mentioned that they were still able to due to staffing issues. I'm just wondering if that's changed at all over the weekend, and if those who are working at Northwood are going to be exclusively working at Northwood during this time.
Certainly, and part of the long-term care directive is that if staff who are working in a facility where there is an outbreak going on, they cannot work somewhere else. And that includes the staff who are coming from the Halifax Infirmary and other parts of the health system to work in Northwood. They need to be there. They're part of an outbreak situation. We don't want them taking the virus elsewhere. We have protocols in place that once they're finished working at the outbreak facility, they can go back and work in their home facility, if you will, but with appropriate protocols to respect safety.
Next, we'll go to Paul Legere, Radio-Canada.
Yes, this question is for the Premier. When I look at what's happening in long-term care facilities in Quebec, the question of possible deficiencies or flaws in their operation is often brought up. Do you think this might be an issue here in our province?
Well, each one of the outbreaks that you've seen, or each one of the cases that you've seen, have been different across the province. What happened at Northwood, there was a large number of staff who had been infected, test positive for COVID. Obviously, they were at the time. We were reducing what they did to contact that. So we ended up having to bring in support from the Nova Scotia Health Authority. It started really last Thursday when we saw they reached out to Dr. Strang with issues around staffing. And then we reached out to our partners in the unions who have reached out across their network to provide us with support, whether that's nursing, CCAs, or cleaning support inside of our facilities.
Go ahead, Paul, if you have a follow-up.
Yes, I'm just wondering, I know the answer to this question already, but with the arrival of virus like COVID-19, I assume we're going to have to look at long-term health facilities in the future, how we can learn from what's happening now and put in necessary protocols in place.
I think there's no question we'll be looking at it from a public health point of view, from a structural point of view. What is the right size of units? As I said to one of my questions earlier, all new facilities now have single rooms in them. We provide assisted living connected to many of them so people can age in place. So I know from our perspective, when COVID-19 is controlled and we're able to move back to some level of normalcy, we'll certainly be looking at how do we provide long-term care. I think it's important. These facilities are homes to people. They're not institutions. We often refer to them as institutions, but they're actually homes. People, many of the ones that I visit and go into, literally, it is, and I often comment this when I'm talking to them. I thank them for welcoming me into their home, and that's what it is, and that's why we will continue to try to improve the environments, not all across the province. And I want to be clear: Northwood has provided tremendous care to its citizens. I've had a number of people who've had family members there talk about the great care that they had. But there's no question we had an outbreak that came in with a large number of staff unknowingly, and now we're dealing with it in the facility. And we're really grateful for the support they're receiving from the healthcare sector across the province.
Next, we'll go to Brian Flynn from All Nova Scotia. Go ahead, Brian.
Thanks, Tina. Dr. Strang, can you say what proportion of testing is now directed at the long-term care sector? And I'm asking because the number of cases among residents and staff has roughly tripled since I think it was Thursday. And I'm just trying to understand if that's more a product of intensive testing in a population that had COVID, or if it is really showing how fast-moving this infection is.
So I don't have the volume, all the testing everywhere, but we know that we're still doing a lot of testing across the province, but especially focused in the areas that have been identified as areas of concern for the last week or more. One is in the Dartmouth East area, where we're still have a heavy push on trying to test as many people as possible. The other one is in Northwood. So there's a high volume of testing going on with Northwood. As I said earlier, another question, we're going to be doing even more testing in the coming days. So that will drive a lot of our total volume testing, but we're doing upwards of 1,000 tests a day, and that's coming in from a number of places across the province. Certainly our positives, as I said, the vast majority or a good majority of our positives today are a result of positives coming out of Northwood.
Go ahead, Brian, with your follow-up.
Thanks. Premier, I wanted to ask you about prescription drug dispensing fees. Health Canada advised provinces back in March to limit refills to 30 days to protect the drug supply. And in Nova Scotia, it was the College of Pharmacists that put that into effect. It's had an impact on consumers. They're paying more dispensing fees. And in some other provinces, government has stepped in with assistance. Are you preparing to get involved here?
Yes.
Thanks. Next, we'll go to Jennifer Henderson from the Halifax Examiner.
Thank you, Tina. Hello, Premier, Dr. Strang. Dr. Strang, is 46 cases today a new high?
Yes, that is. I believe the previous high was 43, so that's the highest number of cases we've had in a single 24-hour period.
Okay.
Go ahead, Jennifer, with your follow-up.
Some of the testing centers at the hospitals, I think Truro and Spring Hill, were shut down because of the tragedy over the past 24 hours. Are those testing centers back up?
Yes, my understanding. Yeah, the Colchester Hospital was on lockdown for a number of hours yesterday, but that was lifted by early afternoon and operations back to normal.
Thanks, Jennifer. Next, we'll go to Kyle Shaw from the Coast. Go ahead, Kyle.
Thank you. Dr. Strang, as you just said, 46 new cases is the most we've seen in one day. But today we also had 48 people recover from the disease. So our number of active cases actually went down. So how is Nova Scotia doing right now? Are things out of control? Or are we looking good? Or are we on track with projections? Or what?
So I think we need to look at it in a number of different ways. So in general, when you look at the COVID-19 across the province, our first step is what we report publicly. We're reporting by health zone. In western, northern, and eastern health zones, we have sporadic disease activity with localized cases, a few clusters going on but we don't have any indication of any substantive community spread. Within Central Zone, which incorporates HRM and West Hants, we have more community spread, certainly in the HRM area, focused mostly in the Dartmouth communities. Within that, it mostly has been in what I call the Dartmouth East communities, but we're now getting a bit more activity in for instance, Dartmouth North, and so we are seeing more community activity there. However, when we look at the overall pattern, the numbers of cases are slowly coming down, so we're on the downward trend, even as we're getting, as that's the area of the province where we more have substantive community spread. All our other, I said today, there was 8 or 9. I'm just looking at the number. Community long-term care facility outbreaks, but those are all but one are well controlled. So we have a very serious and concerning situation in Northwood, which is driving a lot of the data. But it's not. There's not community spread there because it's within a confined environment. So you almost can't look at this from a global provincial picture. We have to tease it apart. It's too early, though. Even though I said we have signs of decreasing disease activity in general, it's too early for us to kind of say we are clearly coming out of the woods. We have to continue this and watch this continue with our strong measures for the public while we pay particular and intensive efforts on situations like Northwood, and also we've done that in the Dartmouth area as well, where we've identified community clusters, going in there with a much more comprehensive response focused on increasing capacity for testing, increasing the necessary supports to communities. And we'll continue to do that if we get more community clusters or additional long-term care facility outbreaks.
Kyle, do you have a follow-up?
Yes, thank you. And sorry if I didn't clue into this yesterday, but I'm confused about the recovery unit at the hotel. Why is it that patients at Northwood who've recovered are moved out to the hotel, and why isn't it sick patients who are moved out? Because presumably the recovered patients would have some immunity.
So we're moving them out for two reasons. We believe they probably have immunity, but again, we don't know for sure. This is a new virus. Typically, with respiratory viruses, you get some longer-term immunity, but also a lot of these are frail elderly. We don't know how strong their immune response would be. So we want to protect them by moving them out of the facility. But also we know that because they're considered recovered, there's a very low chance that they are infectious to others. So by moving them out, we're not running the risk of taking the virus somewhere else into another facility. Also, by removing them, we're now create more space, more flexibility within the Northwood environment that they can able to cohort. Moving out the recovered people frees up more space in their COVID units, gives them more flexibility to move people around and do a better job of separating people who are known positive from others. We've talked extensively over the last couple of days about this strategy, and I've talked with clinicians, geriatricians, infectious disease folks, Dr. Barry Clark, who's the lead in the medical care at Northwood. Everybody is on the same page that actually moving the people who are positive has a number of risks to it. First of all, moving any of these individuals in the state of health that they have it can put their health at risk just simply from being moved, especially if they're actively ill. It's safer if they're recovered. There's also big risk of taking people, either they're positive or many of the ones that are negative today. We know the way this outbreak is going, they're probably already infected. And either of those patient groups who run a real risk if we move them in another facility. Now we've created a second facility with a large outbreak, which puts even more strain on the healthcare system. So the logical conclusion everybody's come to is that bring in the necessary care to look after people who are sick within that facility, protect as best we can those who have not yet tested positive and do aggressive testing, and then move out the people who have been sick and have recovered for the reasons I've outlined.
That's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. We have seen people come together online organizing vigils in memory of the victims. And many of you are posting photos, wonderful memories of the people we have lost. And I understand how difficult it can be that you can't come together to grieve in person. And we as a province want to honor those who died as well. But you must listen to what Dr. Strang is saying when it comes to continuing public health protocols. We cannot forget that in the midst of this tragedy, we are still fighting a deadly virus. We need to continue to flatten the curve on COVID-19. The next 2 weeks will be critical, and now more than ever, we need your cooperation. This takes inner strength. The best way that we can honor the victims of this tragedy is to continue to act in a way that protects our fellow Nova Scotians. And perhaps another way is to honor them is something that I've seen online. A Nova Scotia tartan scarf tied around a tree. Or if you don't have tartan, the suggestion is a blue ribbon. And you can even put that in your window or on a balcony. You can see that Dr. Strang and I are wearing the Nova Scotia tartan today. It may not seem like enough, but for now, it's a way for all of us to come together without coming together.